Okay, this is day 9 after surgery. I'm doing really good. Still having some problems, not really problems, hip pain from the bone marrow for some reason. Right where the injection site is, where they drew the bone marrow out. Still having some hip pain. Mobility, raise both my legs up. I can sit, I can stand. Still a little soreness right at the bottom of my tummy where they, again, make the incision and pull everything apart. So right through this little area here, still a little sore. Back is doing fine. There's no redness. There's no swelling. I still got a perfect stitch line. Again, I'll stitch some pictures in here throughout the video. I still got a nice straight incision line. Staples are still mostly there. I think I lost 1 or 2 staples just from pulling the dressing on and off. I've been changing the dressing every other day. Took a full shower on Wednesday, full shower today. They want you to keep it dry and covered up, especially the back and front incision. I should say, especially the back incision, since it's stapled shut. I'm sure they glued it also, but the front incision still has steri strips and stuff like that. You just wait till those come off. You don't try to pull those off. Eventually, shower, water, they'll come loose and the steri strips will come off. That's when you know the front incision is ready to take loose. As far as the back incision goes, when you get back to your surgeon, he'll remove the staples for you, and I'm sure if there's any steri strips there, he'll probably pull the rest of the steri strips off just to check the incisions on the front. Now, depending on your doctor, I actually had 2 doctors. I had a gastrointestinal or a general surgeon do the front, and the neurosurgeon did the back. So the general surgeon basically opens you up, pulls everything aside, puts the stuff in there, retracts you open. Neurosurgeon goes in, puts the spacer in your back. If you're getting a spacer done, if you're getting the ALIF done, puts the new disc in there, I should say, instead of the spacer. Puts the wedges, the disc in. The general surgeon will close you back up, seal you up, they flip you over on your back, and then the surgeon will open up your back and do the rods and pins, whatever you need to put your spine back in place and keep you stable. So tonight, or last night, I was able to lay on my side all night long. I actually stayed in bed all night long, so that was a good thing. For the most part, I still got up at 3 o'clock in the morning, took my Percocet. So I took a Percocet at 9, which is a 5 milligram, a Percocet at 3 a.m. That seems to get me through the night. I'm not a regularly good sleeper anyhow, so I toss and turn a lot. I think when I'm turning at night, you're asleep, so you don't think about it. So when you toss and turn, things pull and push like, they normally would, except for now they hurt. So that's about it for today. Again, voice is still not 100% back yet. It feels better than it did the other day, so forgive the voice if it's not high enough or low enough. Again, I wasn't expecting my throat to be sore for a few days after the surgery, but it is. And again, I'll do another update in a couple days.